Welcome to this Global Health Series. I'm Vivian Kopsinger-Birchall, your host, and my special guest is Dr. David Pate. Doctor, welcome to our show.
Thank you. Thanks so much for inviting me in.
So just to tell us a little bit about yourself, and
Sure.
We'll take it from there.
Yeah. Right now, I'm currently a professor at University of Wisconsin-Madison in the School of Human Ecology. I'm in the Department of Human Development and Family Studies and Consumer Science, and my work has been for the last 20 years or more examining the life disparities and well-being of black men. Black men who make less than $5,000 a year, or their children have been involved in the welfare system within our country. So I really examined what are some of the systemic issues that really prevent black men from being involved with their children.
Yeah, and before we went live, we were talking about the incarceration rates among the communities that you're working in.
Yes.
Can you tell us about, before we get into why we're here today, just statistics on the incarceration rates?
Yeah, Wisconsin is really unique in that it's 6% black in the state, but we have the highest incarceration rate of all black men in the country. In fact, our prisons are about 50% black in the state of Wisconsin, and we have 11 different prisons where people are incarcerated from minimum to maximum. And then also we find in the city of Milwaukee that it is a city that is the fourth poorest city in the country. But Milwaukee is also known for being the most segregated city in the country. So there's a lot of things around race that are very clear. And Milwaukee is also the city where it's the most populated with black people. But also we have the highest rates of poverty there as well. So it's a very unique space for the work that I do, but also for understanding how poverty intersects with well-being and access to services.
Well, first of all, there's so many cards stacked against the black person. Yeah. First, there are incarceration rates, 50% of just the 6% who live in that town.
In the country, in the state.
Yeah, in the state, sorry. Yes. And then you have we talked about the poverty rates. So you have incarceration, poverty, and a lower population number. Mm-hmm. So in terms of, and you talked about, the intersection between those issues and where the quality of life. Mm-hmm. So let us take back to why you're here today. This is a cancer conference. Cancer and other non-communicable diseases. Yes. It's a global health catalyst. Mm-hmm. Why did you choose to come here today, and what do you hope to achieve?
In my more recent study, I've been talking to men who are coming out of prison. I've talked to men who have been in prison on average at least 10 years. But I've talked to some men who have been in prison for 40 years. I'm trying to understand what is the transition when you've been incarcerated, prepping you for release, and then when you are released, what are some of the things that work or don't work for you? And so because of that, I've also learned about their health status and their access to health care. Unfortunately, for so many of these men, the best health care they get is when they go to prison, because so many of them do not have access to health care when they're not in prison, either because the jobs that they have don't provide private insurance, or they don't have children in their custody, and that's the way the health policy system is created within the United States, is that you can get access to health care if you have a child in your custody, like Medicaid, but if you don't have a child in your custody, either the state may provide some kind of free health care through public health services, or they may provide services through the Obamacare or the Affordable Care Act, where states could take a Medicaid expansion money, and that will allow anyone who is an adult to get access to health care. Unfortunately, at least 15 states in this country have decided not to take that money because it was based on political affiliations, and because they were run by Republican, they did not want the Republican state did not want the money from a Democratic president. And Wisconsin was one of those states again where they denied that money that would not cost them anything but would provide a benefit. So the other thing about that is because men often don't use healthcare the way they should, we've learned through my own research and working with other public health officials that cancer is explicit and more prevalent amongst those in the incarceration population, and that black men have a more, what would you say, they contract cancer more, and when they come out of prison, they're more likely to die 30 months earlier than their white counterparts who have also experienced that same type of cancer. So for me, it's this issue of looking at what are these social determinants of health or life experiences that really do decrease people's livelihood and ability to be able to live a full life and take care of themselves and their children.
Well, it's great, first of all, that you brought out the social determinants of health, and we'll get into that a little bit. But just thinking about the scenario that you just presented, that is so sad. The disparities are so glaring, and it's like a whole ecosystem of that is set for failure for these incarcerated or formerly incarcerated men. And you mentioned one alarming kind of scenario where they have better health care in the prison system than when they're out. And tying healthcare to custody of a child, that is cruel. So in your conversations with policymakers, and I'm assuming you've had some conversations with policymakers, what are some of the thoughts around changing that? And if there are interventions, what are some of those interventions? And in the same vein, when we're talking about the social determinants of health, can you describe what some of these determinants are for, in addition, of course, to the lack of money that you just pointed out, they have low employment for these incarcerated men? Well,
look, one of the things, you bring up a lot of good points, and I'm going to try to remember all of them.
It was a mouthful.
But that's good. But the one thing that sticks out very clearly for me with these men is when they're released from prison, their biggest issue is housing. And if you don't have a place to go wash up every day, if you don't have a place to prepare good food, if you have a place to feel secure, all of those things go into that social determinant of health. If your mental health is affected because you can't figure out how am I going to even get to my job because the transportation is somewhat lacking, all of these go into increasing the amount of stress, which we've heard about in this conference. But also, the other thing I want to recognize, what you said to me earlier, what brought me to this conference and why, is that even in the conference today, the focus is a lot on women. There has not been a lot of focus on men. There's been some kind of referral to men, but I've heard a lot about cervical cancer. I've heard a little bit about prostate cancer, some things about lung cancer. But with black men in particular, they die from issues of colon cancer, they die from issues of prostate, they die from lung cancer in very high rates. And so in these communities I'm looking at, for example, in Milwaukee, I'll give you an example, in zip code 53206, we have the highest incarceration rate just in that zip code in the world. Like almost every single person in that zip code has experienced incarceration in some kind of way.
In the world?
In the world. And
that's insane.
It's documented. So when you're incarcerated too, it affects your family in some way. It affects your family in that there's money that has to be paid out for a bond, or there's money that has to be paid for restitution, or there's money that has to be paid while you have a bracelet on you, or this is a lot of income that's being drained from that community that people don't think about that. And also when you go back to the reason of why do we allow this to happen, because the United States is very much based on meritocracy, that if you work hard enough, then you should be fine. It's very based on individualism. You made a choice, it's your responsibility. And then President Clinton, who really instituted that whole idea of personal responsibility and work, is not looking at what are the systemic issues that have been really somewhat oppressive and discriminatory to those who have been descendants of enslaved people. So some of this is very historical, and people are not willing to even do critical analysis. And as a professor, one of the things I find very difficult with my students is forcing them to be critical thinkers, because we're not training students to think. We think that if you just do A and B, then you'll be fine. But it's not that simple. And when your life has been somewhat under surveillance for your entire livelihood, and also when you're seen as less than, because race, as we currently view it in America, is very much a social construction, and race equates with slavery. That's the only reason we have a racial construct in this country, because someone is seen as better than the other. So all of those things go together around social determinants, but also historically there's been a number of policies that the federal government has even put in place that makes it difficult. But the biggest issue around social determinants for these men is housing and employment. and access to health care.
And I think you mentioned a number of important things. I can't even split them out, but one of the things you mentioned was the policy by President Clinton.
Yeah.
I think that I don't know whether he realized at the time that he was hurting communities, but it brings up an important issue, which I think I'm hearing you say, that the political economy of health is not considered a lot, which covers the history of the country, history of communities, and how it intersects with how they access healthcare. And then my question to you is, as we're advocating for some changes in this system, especially in this context for incarcerated men, what are your thoughts and what have you heard about advocacy for universal health care, for example? I bring this as a monster, but
I laugh because, as you know, when we were trying to do Affordable Care Act, people were wondering why, when I was living in England at the time as a visiting professor at York University, and they were saying, why doesn't your country want everybody to have access to health care? Why? Because people were concerned that it was a requirement that people had to have health care. If they didn't, they were going to be fined, even though few people were going to be fined. And also people were concerned that we were saying in this particular policy that parents will be allowed to cover their children until they were 26. All of the things I thought would make for a difference for a healthier country, a healthier community. But we are so vested in, again, going back to individualism and the whole idea of exceptionalism, and we're different and don't make me do anything. That's what our democracy allows us to do, which is true. A democracy is a wonderful space to be in. And to be honest, the whole idea of saying that you have to have health care is a form of socialism. It's not, but it also was to the benefit of everybody to have a healthier life so that you'd be able to do your job and not have to have some of those worries about health care. Because that particular Obamacare or Affordable Care Act really has a lot of great prevention requirements in it, as well as the fact that people couldn't be fired if they came with a pre-existing condition. So the biggest issue was people didn't want to be told what they had to do. And I have to say it leaned more to those who may be not minoritized or marginalized, because they do have a little bit more access to make decisions. They have a little bit more privilege than others. So it's a complicated answer, but the simple answer is people don't want to be told what to do in America.
Right, and you mentioned socialism. I could get in so much trouble just trying to to break apart what the term is and how it has been used against people on the margins of society. Yeah. Because when you look at socialism, the word socialism, where that socialism, capitalism originated, was just a disagreement between two countries.
Yes.
The USSR at the time and the US.
Yes.
Not necessarily that it was a bad thing. It was the other people chose this, we're going to choose the opposite. Yes. A question for you. Is what do you envision seeing as an intervention, especially from groups like the Global Health Catalyst? Because you're here, because you're interested in finding ways to partner with different people.
I mean, I think for me it would be really great to partner through even exchange programs with my students, to be able to get them to see the world outside of America and understand if they're looking at social welfare policy or health policy, how other countries are different, or how we're the same, or also how in this country racism is a unique factor in why a lot of these issues are of concern, versus in other places there's not the issue of race, and maybe other issues that make it very difficult as to why people don't get access to health care or don't have some of the best outcomes they could have.
Like colorism?
Yes, the colorism, which is exactly. But here that issue of racism is such a big issue for so many of the people that I study, and also I think because I want to bring a different voice. I want people to hear more of the social side of this issue. I think because if they do work where you're going to maintain someone's life, you're maintaining their life to live still in an oppressive system. But if we don't do policy advocacy, it's not going to get better for anybody. If we don't really start critiquing how people's lives are forced to live under conditions that are unnecessary. And I think for a place like America where we have so much money and so many resources, it's just really unfortunate the number of people who are living on the street or who don't have food to eat every day or don't have a place to live because of the fact that we just really focus on it's your responsibility, you've made a choice, when oftentimes we're finding in research now that some people, when they're born into wherever they're born in what zip code, their life expectancy is already determined. Mm-hmm. And that's a real thing where we could do better. and avoid some of that, some of those outcomes.
Yeah, your voice is much needed, especially since we have the White House Office of the Cancer Monitoring present.
Yes.
If they're saying we want to reduce cancer deaths, I think it's important to integrate all these populations and all these factors in place so that we don't address cancer in certain demographics, but think of all demographics, including the incarcerated.
Yeah. And that's the other reason why I decided to focus solely on an incarceration population, because there's so many black men who have been touched by the incarceration system. And I'll use a real quick example. When I do qualitative research, I go into neighborhoods to meet people where they are so they feel comfortable talking to me. And I go into neighborhoods that are usually very poor, but I was required at one time to drive a new car every time I would go do my research, because the university wanted me to be protected under one of their policies around the car I drove. So I was becoming a target for police. They thought I was a drug trafficker. And they would stop me when I was trying to do research and say, why are you here? What are you doing? And I couldn't say I'm coming to do an interview because that's confidentiality. I will violate my IRB. And so I had to also figure out, how do I modulate my own stress? Because that's very stressful to be every time. And they were trying to wonder and there's nothing on me, so they had to let me go. But I'm also someone, just because I have a PhD, I don't have it written across my head. All they see is a black man in his new car in a very poor neighborhood looking for an address. And why is he always here? Because in black neighborhoods in Milwaukee, they surveil the neighborhood all the time. And they can stop you at random and say, can I see your ID? And if you don't do it, you're not cooperating. They take you to jail.
It just reminds me of Trevor Noah's statement, once you're black. I think it was about him, but it applies to all black people. Born a crime. Mm-hmm. You're born a shade that everybody looks at, and you look like a criminal. Step up, which is sad. Yeah. I laugh, but it's not a happy thing. Sometimes sad things make, But this is so important that you bring it up, because as we're discussing really making a difference, how can we do that if we are leaving communities behind? So I am so grateful that you are able to kind of highlight this issue. And I guess my next question would be, what would you want our viewers and the partners here to do as the next step? Because it's one thing talking about it, it's another giving a call to action.
Yeah. The one thing I find, and I go to these meetings, right now as an observer of people who have come out of prison to hear what their concerns are every week. And the one thing that's taught me to do better is to be more humane, to treat people with better humanity, to don't see them as someone I should be scared of. I'm not saying that there's not people whom we shouldn't be kind of cautious about, but it's not like every single person who's committed a crime is the devil or someone who's going to make significant harm to you. I think a lot of what the work I do starts with us individually figuring out or saying to ourselves, who are we, what are we about, and how can we make the world a better place? How can we spread love in a way that is more humane? How can we spread love in a way that makes a difference? Because right now this world is so full of hate and so full of anger and so full of selfishness that we don't look at those who have had less and have had lives that have been very traumatic, based on certain policies, based on certain practices, and based on some historical ways of living. That I would say it has to start with each individual person, whether they have a doctorate degree or they are the clerk at the local grocery store and they have an 8th grade education. None of this is going to change until we all decide that everyone is an individual who deserves humanity. That's it.
That was a perfect way to, ending for this section. But did we leave out anything that you may have wanted to say?
I don't think so. I think you were a good interviewer. I was trying to think, wow, I got to be on it. She's good.
No, with that, I just wanted to say thank you for being a guest on Global Health Series. Yeah. And thank you for the work that you do. That research is needed, and that connection with that community is definitely much needed so that they're not left behind. So again, thank you for the work. And
thank you so much for inviting me.
And to our viewers, thank you for watching this episode of Global Health Series. Till next time.